Well, tonight things continue to improve tremendously at Desert Regional. Not only is the number of COVID patients dropping, but there are now 0 COVID patients in the ICU. Meanwhile, the hospital is about to ramp up its vaccination efforts. I spoke with the hospital's chief operating officer, Mike Ditoro. Mike, it's good to see you again. Thanks for joining us.
Likewise, Peter. Thanks for having me.
First off, what's the latest at Desert Regional?
Well, our COVID numbers have, our census is down to 12. We've been coming down since the beginning of the year. When we look at our positivity rate, it's at 4.4%, which is down from 11.4 in February and 23% in January. So the testing numbers are supporting that decrease in our census.
And I understand 0 COVID patients in the ICU.
That's correct. Yes.
So what do you attribute this dramatic change to?
Well, I think it's a combination of folks following social distancing, as we've been talking about, taking precautions with masks. The vaccine is starting to get out into the community, and there's a lot more efforts to get it out there. So I think those are the two big things that are really helping to drive it, to get it down.
And speaking of the vaccine, how are things going with it at Desert Regional?
It's going well at Desert Regional. We have the vast majority of our staff has been vaccinated here. We are continuing to do community events, and as the Blue Cross and Blue Shield My Turn application starts in April, we're going to be ramping up some of our community efforts between all 3 of our facilities in the Desert Care Network.
Oh, okay. Yeah, because Eisenhower just announced that they'll become a public vaccination site after they expect to receive more doses in the near future. So it sounds like Desert Regional and JFK may have plans to do something similar.
That's correct, including High Desert up in Joshua Tree. So all 3 of our facilities will be doing community events, and in different communities as well, where our hospitals are represented.
I'm curious, now that the cases of COVID patients is dropping, are there any plans to change the visitor policies at the hospital? And if not, do you plan on looking at that in the near future?
We have changed the visitor policy now. We're following what the state's recommending. So every patient can have 2 visitors come in, and we implemented that over a week ago. So it's been a nice change for our patients, just really improves that caring environment, and you have a support structure around the patient. So it's been nice to be able to get the visitors back in to see their loved ones.
Yeah, understandable. And we continue to get some interesting questions from viewers. One is there a difference between the first dose given of the Pfizer or Moderna vaccine and the second dose? So could someone technically get their second dose of a vaccine at a clinic that is only offering first doses and be safe?
Yeah, there's no difference at all. It's the same dose, same volume. Everything is the same between the first and the second dose, Pfizer to Pfizer, Moderna to Moderna.
So overall, though, it sounds like things are going very well right now.
It is, and we're going to hopefully stay on this trajectory and continue to be smart and do the things that we need to, that we know are working to prevent the spread. And we're just excited to further get that vaccine out into the community as well.
And I bet the morale among staff must be improving tremendously, because I know they were under a lot of stress during that.
I think we're seeing that lift, and we are just still amazingly supportive and appreciative of everything that our team member, the staff, has done to get through this. It is nice when we walk the floors to see the patient, or the patients more not COVID, and the staff caring for what they used to, and they're just, you see a little bit of that relief. So we're excited to be turning a corner.
I'm sure. All right. Well, Mike, it was good to see you again. Thanks so much for the update. We appreciate your time.
All right. Thanks, Peter.